The late famous medical medical sociologist Renee Fox used a concept of detached concern. She said that's the ideal that medical training is aiming for, is detached concern, a kind of care and seriousness, but not too much. The famous, most famous physician in the United States, William Osler, used the term equanimitas or equanimity, which was an ideal that conveys a kind of balance between like detached concern of seriousness and focus and care and concern, but not being drawn in the way, say, a parent would with a sick child, where you're overwrought and you can't act with dispassion and with clarity. I think personally, going through the training myself and watching many others and being involved in teaching, that it really is not necessary to encourage students to not get detached morally. I mean, to not get too detached emotionally. That instead of, and this kind of draws on Aristotle's idea about aiming at the mean relative to us. So he had this idea that between virtues and vices, you have kind of a spectrum, you have a spectrum of, and virtues are kind of aiming at the mean between, let's say, being too angry and excitable versus being too passive. And the virtuous person is in the mean. But he said we have to aim at the mean relative to us, which means that we have to be aware to which extreme, to which way of going wrong are we prone? Do we have a tendency? Because if we have a tendency all in one direction, there's no point in aiming at the middle. We have to aim at the other end in hopes of getting to the middle. Does that make sense? Mm-hmm. I think that's the case with this. Between detachment and concern, all the tendency, all the structures, all the habits, all of our human frailty pushes in the direction of detachment. We all learn detachment incredibly well. Everybody learns to dissect a cadaver. People who say, I don't think I could ever do this, this might be overwhelming, may have tears for a day or two. 2 or 3 weeks in, everybody's doing it, and not many are losing sleep at night. Same thing with treating patients. It's too easy to become detached. So it seems to me in terms of just good moral formation, is we would reasonably encourage everybody to be concerned, to always nurture concern, to consider it an achievement if one feels emotional after caring for a patient, rather than a problem.